Welcome to this new segment of Café con Luis, where we bring you issues of politics and public policy importance to the Latino community in Connecticut. And with us today, the Speaker of the House of Representatives of the Connecticut State Legislature, Mr. Brendan Sharkey.
I wanted to know, we have our elderly population is very, very dear to us.
Yes.
Culturally, we tend to keep our elders with us
Yes.
in our homes, even though some may need to be institutionalized, and we keep them there.
First of all, I think just the demographics in Connecticut are such that we have an aging population, and we need to be mindful of the needs of our senior citizens on whatever level, whether it's healthcare or whether it's financial or other types of support.
And there's a conversation going on now regarding something called aging in place.
Yes.
Which is a rather interesting concept.
Yes.
One, I believe the conversation is partly due to the budget, the increasing
No
budget
question.
deficits, and
No
the
question.
extent to which elderly care requires more resources than are available.
Right.
What might become of that conversation? Would you?
Well, I think it's a conversation that we cannot help but have because of what you mentioned, which is the cost of placing seniors with increasing needs into either assisted living or in a nursing home setting or those kinds of things. There's no question that if we can keep seniors at home where they're most comfortable and provide them the services in their homes, that has much better outcomes than putting seniors into an institution where they're cared for in a very different kind of environment, basically a hospital room,
Right.
where they're being cared for by nurses.
Right.
So there is this movement that has occurred not only in Connecticut but around the country called Aging in Place, and the concept suggests that what we can do is find communities where, first of all, to provide services to seniors in their homes and get those services to them in a way that makes sense. But also what's interesting is that there's been a movement to create these villages of in locations where there's a concentration of seniors, either living alone or with a loved one, where they can all pool together their resources to share the kinds of services. If they're in homes, they can share, they can contract out to have their lawns mowed or their houses taken care of, or if they're in apartments, other kinds of services, food deliveries and nursing facilities and other things. And they can do it all in a group setting where they can save them money. But the whole idea is that that seniors are in a much better place when they're home.